This video is going to cover the CPT book structure for pacemakers and implantable cardioverter defibrillators. And for this demonstration, I'll be using the CPT Professional Edition for 2020, published by the American Medical Association. Within the 2020 version of CPT, this particular book, the pacemaker and implantable defibrillator codes begin on page 217. And as with a lot of sections in CPT, it begins with a lot of instructions. And you'll see in my book, as I went through, I highlighted and color-coded the parts of the book that I need quick reference to. And so all of these different colors mean something different. All of the conventional implantable cardioverter defibrillator or ICD systems have information highlighted in blue. The subcutaneous ICDs have instructions that I've highlighted in pink, and then the substernal ICDs I have highlighted in green, and then just my general comments I highlighted in yellow. That was something that I did to help me be able to differentiate a little bit better. There is this table at the beginning of the pacemaker and ICD section. It's on page 218. And this gives you kind of a quick glance for the individual procedures and then the codes for pacemaker and then implantable defibrillator. And I would say that the biggest issue on all of these is making sure that you are coding to the correct type of procedure. And you'll see I've got more comments here. I highlighted some in purple for leadless. I think that says leadless pacemaker. Probably not a good idea to do that in purple, because now I can't read it. But also highlighted these quick bolded terms that CPT has listed about what is a single, dual, and multiple lead system. Now the rest of the book, I drew boxes around groups of codes to help me organize them better. And so the first section, the first three codes, actually the first two codes, let me mention the first two codes in this section, 33202 and 33203, are implantation of leads either by an open incision or endoscopic approach, so thoracoscopy or, actually going in and doing a thoracotomy. These are not procedures that are going to be done in a cath lab. These are OR procedures. This is likely going to be an inpatient procedure and not something that you're likely to see a whole lot. Starting with code 33206, you will see these procedures more frequently. And the first thing to notice is that these three codes are only for permanent pacemakers. They are not for implantable cardioverter defibrillators or ICDs, and they are coded based on the chambers where the leads go. So the first two codes, 33206 and 33207, are single lead systems, where the first code is where the lead goes in the atrium, the 33207 where the lead goes in the ventricle, and these are all on the right side of the heart. Let's mention that because conventional pacemaker and ICD systems have all of the leads on the right side of the heart. And then 33208 is your code for a dual chamber pacemaker placement. A couple of other things I put in here. I went ahead and put in single chamber versus dual chamber. An additional little comment. I wrote off to the side that these are my pacemaker codes for leads only, and I failed to mention that earlier. This is only for the leads. This is not for placement of the generator. And the notes are continued on the next page. And I think that the AMA does a good job of trying to keep notes on the same page as the codes, but it's just not always possible. So you can see that these notes continue on to the next page ahead, or after that. The next group of codes, 33210 and 33211, not codes that we use a lot. Those are codes for temporary pacemakers. Temporary pacemakers are often placed for temporary use during a procedure. And because of that, they're bundled into a lot of other procedures. So you're not going to be using your temporary pacemaker codes a whole lot. The next group of codes is 33212 to 33221. You'll notice 33221 is a code that is out of sequence. And then I wrote down the side, these are for placement of a permanent pacemaker for the complete system. So 33206 to 33208 were for leads only. This is for the entire system, including the pacemaker generator and the leads. And these are coded as single, dual, or multiple lead systems. And what that translates to is what I wrote off to the side. So single lead is a single chamber, dual lead is a dual chamber, and multiple leads is cardiac resynchronization therapy or biventricular. So this one is going to be more than a dual chamber. Couple of other codes, 33214 is kind of over by itself. That's upgrade of a system of a pacemaker from a single to dual chamber. And then we've got a code for repositioning of an electrode, but you'll notice this is for a pacemaker or an ICD. And rather than highlighting the entire code description, I just highlighted the repositioning of just the electrode, and I wrote off PPM, permanent pacemaker, or ICD, implantable cardioverter defibrillator, off to the side. The next group of codes, 33216 to 33218, didn't have a whole lot of room to write at the top of the page here, but I wrote in, these are new leads added to an existing system, codes 33216 and 33217. Those are for ICDs and permanent pacemakers, either one, and this is leads only. And your code number is based on the number of leads placed, not the number of leads in the system. So unlike your codes 33212 to 3321221, these codes are going to be based on how many they put in. So you've got a choice of 1 lead or 2 leads. And again, this is just putting in the leads. This is not putting in the generator at all. Lots of important parenthetical notes. I'm not spending a lot of time talking about parenthetical notes here, but I put brackets around this because I think some of the codes for being able to add additional leads to an existing system or, changing out a system can be kind of confusing. So I just bracketed that to bring my eyes to it. I was afraid, at least for me, if I highlighted it, then it would look like my entire book was highlighted instead of just pulling out those couple of things. The next set of codes are for repair of electrodes, either a single electrode, 33218, or a pair, 33220. Repair of electrodes is not terribly common. I think usually if there's something wrong with the leads, they'll just go ahead and cap the lead, leave it in place, and place a new one. So using the codes for the placement 33216 and 33217 are going to be more common than using the codes for repair. We have 2 codes for relocation of a skin pocket, one for pacemaker and one for your ICD. These codes have undergone some edits over the last several years. This used to be for revision of a skin pocket, and there was a lot of confusion on when that could be coded, especially when you're upgrading from, say, a pacemaker to an ICD device, where the device itself, the generator, is bigger in an ICD than it is in a pacemaker. So that pocket revision is included so that they can make it bigger for that device. But this is now just used when they completely relocate that pocket. And we see that for patients who have a pocket infection and they relocate it to a different part of the chest. Not terribly common. This is probably going to be the only procedure done in that particular setting. The next group of codes, and you're kind of limited with space on where you can write things in your CPT book, but this entire right side of the page is for biventricular pacing. And biventricular pacing is also known as cardiac resynchronization therapy or CRT, so I wrote that into my book there as well. There are 3 codes. So you've got 33224, and you'll notice it's not an add-on code. This is the code for placement of the left ventricular lead or a coronary sinus lead in an existing pacemaker when all they're doing, or ICD, let me back that up. So a patient has an existing pacemaker or ICD, and they are looking to turn it into a biventricular device by adding a left ventricular lead or placing a lead in the coronary sinus. This is that code. So 33224, pacemaker's already in place. We're just switching it over now to a biventricular pacemaker. For somebody who comes in for a brand new placement of a device and they place that left ventricular or coronary sinus lead at the same time, we have add-on code 33225. And it gets added on to the code for the placement of your pacemaker. The other code that we have is for repositioning of a CRT lead. So over here, through code 33215 would be repositioning of a previously implanted pacemaker or implantable defibrillator electrode, but it does specify right atrial or right ventricular. If they reposition the left ventricular or coronary sinus lead, then you're going to go with 33226. Some additional codes here, and I just so you know, I find the organization of this section of codes confusing, and even after several years of coding these, it's helpful for me to mark up my book this way to make it easier and quicker to locate codes. So we've got 33233 is the code for removal of a pulse generator only. So if they're only taking out the pacemaker generator without the leads, then your code is 33233. Codes 33227 to 33229 are the codes for removal with replacement of the leading of the pulse generator. Wow, hard to get that out. And these are coded based on the type of system. Again, single lead is a single chamber, dual lead is a dual chamber system, and multiple lead is cardiac resynchronization therapy. And I wrote off to the side here, this is replacement, this is just removal. And then we have other codes for our pacemaker removal here. Codes for removal of electrodes. Sorry, just had a brief TIA or something right there. We have a single lead system and then a dual lead system. These are codes for the removal. And I actually chunked out these other 3 codes, 33236 to 33238, because I've never assigned them. These are OR procedures where they're opening up the chest, and not something that we would be coding in the cath lab, likely not something we would be coding in the outpatient setting at all. So I have them split out so that I am sure not to assign those if I'm coding for a cath lab procedure. I will say that removal of electrodes is very rare. Usually they leave electrodes that are no longer functioning in place, but they cap them. And make sure you're looking in the documentation for that. They're usually really clear about anything that's been implanted or explanted. And then we start to get into our ICD codes. So we've got code 33240 is the code for insertion of the pulse generator only with an existing single lead. And then we have, again, dual leads, meaning dual chamber, multiple leads, meaning a CRT device or biventricular device. 33241 is the code for removal of a pulse generator only. And again, this is an ICD code. And then codes for replacement of the ICD, just the generator. And again, these are coded based on the type of the system. The last part of this, and you know, I write on here when my notes are continued onto a different page so that I'm sure to keep reading. And we know that a CPT has a tendency to embed guidelines and instruction in places other than we're used to looking. So make sure that you are looking at all of your guidelines. So the last section of, well, I shouldn't say the last section, the second to last section is looking at more OR procedures. So these are removal of electrodes, again, by an open incision. And then we're getting down into insertion or replacement of a complete system, single or dual chamber. So whereas we had 3 codes on the pacemaker side, 33206 to 33208, to report insertion of a pacemaker using a single lead in the atrium, in the ventricle, or a dual chamber system, we only have 1 code for ICDs for insertion or replacement, and it does not specify that this was it does not specify the type of lead specifically. The last set of codes here are some newer technologies, and I've divided them into a couple of different sections. The subcutaneous ICDs, which are defibrillator systems that are placed in the subcutaneous tissue. So rather than having leads going inside the heart, the leads are placed close to the heart in the subcutaneous tissue, and you still have a pulse generator, having trouble getting those words out today, that helps to defibrillate the heart. So these SICD codes are found towards the end of your section for pacemakers and ICDs. And the last 2 codes in this section are for leadless pacemakers. And leadless pacemakers have a small device that is placed inside the heart. And rather than having a separate subcutaneous pocket for placement of a generator, the entire device is plugged into the inside of the heart to be able to pace it. So we've got 33274, which is our insertion or replacement code, and then 33275, which is the removal code. The only section that I didn't really go over here were the new technologies, and for 2020 there are new codes for substernal pacemakers, substernal ICDs, and lots of coding guidelines as well. So this section, which starts on page 805 in the 2020 Professional Edition, is for implantable cardioverter defibrillator with a substernal electrode. This is kind of similar to a subcutaneous ICD, where the leads are placed on the back side of the sternum, the breastbone, rather than being placed inside the heart or in the subcutaneous tissues like we see with a subcutaneous ICD. And most of the codes that are here mirror what you see in the rest of the pacemaker and ICD section. So that has been a quick demonstration and overview on the pacemaker and implantable cardioverter defibrillator section of CPT. And I hope it helps you to find these procedure codes more quickly and efficiently.